bartering can become very complex. It should be evaluated within a cultural context. In some cultures and in certain communities, bartering is an accepted practice. But keep in mind that bartering is a dual relationship and professional judgment should be used. I have a counselor friend who bartered twice for services. In the first bartering situation, he was working with an artist who did beautiful artwork. They sat down and talked about some of his paintings and how many paintings he would give the counselor versus how many sessions. That bartering relationship actually worked out really well. He continued seeing the counselor. He gave him some paintings in exchange, and they were both very happy. The other bartering situation involved a gentleman who was doing really good work in the counseling relationship. He was meeting his goals. He was showing up, but he ran out of funding. And so they decided that since this client was also a painter, that to continue services, he would paint the counselor's deck. Now they talked about again how many services he should get for painting the deck and how long it should take, and worked it all out like he did with the first arrangement. However, this time the client didn't show up on time, didn't get the painting done like he said he was going to, and really didn't do a very good job. This absolutely affected the counseling relationship because the counselor admitted he was very resentful and angry about the poor work that the client did. So before entering into a bartering relationship, both parties should really talk about the arrangement. Have a very clear understanding of the exchange, and you should both agree on it. I would absolutely say that you should document it and write it down also. Bartering is not prohibited by ethics or law. But there are a lot of risks, and bartering should only be used as a last resort. When it comes to giving or receiving gifts, you should review each situation on a case-by-case basis, again, taking cultural context into account. Factors that should be reviewed before accepting a gift include the monetary value of the gift. Now, giving someone cookies versus giving someone, like the counselor, jewelry could really have different implications on the therapeutic relationship. What are the clinical implications of accepting the gift? When in the counseling process is the offering of a gift occurring? So, for example, in the beginning, what if the client is on probation? Is he going to expect you to give him a good report? For the gift giving, you have to be really careful about things like that. What's the motivation of the client? Make sure your boundaries are very clear in accepting the gift and that you're comfortable accepting the gift. And be aware of cultural implications. In the Asian cultures, it could be a way of showing gratitude and respect, and refusing the gift would be an insult. We're going to talk about social relationships with clients. In the ACA 2014 Code of Ethics, A53, it talks about personal virtual relationships with current clients. This is the first time that a Code of Ethics has really talked about social networking and how it might affect the therapeutic relationship. It says that counselors are prohibited from engaging in a personal virtual relationship with individuals with whom they have a current counseling relationship through social media and other media. Your chapter talks very clearly about why we should not become socially involved with our clients. When we have our clients become our friends, one of the implications of that might be that we might not be as confrontive as we need to be. We might be able to tell them what we're really seeing, or confront them with behaviors that might be harmful to them, because we might worry about losing them as a friend. Maybe the counselor's own needs to be liked can lead them to be less challenging in the relationship. The counselor's own need to be liked and accepted may lead them to be not only less challenging, but also enmeshed with those of their clients to the point that objectivity is lost. Counselors are at greater risk of exploiting clients because of the power differential in the therapeutic relationship. So the safest policy is to avoid developing social relationships with current or former clients. In the future, they may not be able to use you if needed for your professional services because you've crossed that boundary. The imbalance of power usually never changes. They usually will always view you as the counselor. There is a distinction between finding a client sexually attractive and being preoccupied with this attraction. If you find yourself sexually attracted to your client, it's important that you examine these feelings. Remember, in previous chapters, we talked about sexual attraction could be a sign of burnout also, so it's important that you take a look at that. Intense preoccupation with your clients and your feelings about your client is problematic. You should seek help either from a colleague, a supervisor, or go get into some counseling yourself and find out what's going on. It's important to know how to establish these boundaries when sexual attraction occurs, and you need to really be familiar with if you can continue the therapeutic relationship and remain objective. Some of the suggestions for dealing with sexual attraction include acknowledging the feelings of sexual attraction to yourself. This does not mean you need to go and talk to your client about it. That could be some manipulation to find out how they're feeling. If you have these feelings, it's your problem, not theirs. You should talk to supervisor, colleagues, or other counselors, get into counseling, but it's not something you should be processing with your client. Explore the reasons why you might be feeling this way. Is there some countertransference going on? Never act out the feelings of attraction. What do we mean by this? Sitting too closely, hugging. Don't ever act out on these things. Seek personal counseling if you need to understand your feelings about the client. Monitor your boundaries by setting very clear limits. If you're unable to resolve your feelings, terminate the professional relationship. Remember, this is your problem, not the client's. Remember that there are varying degrees of sexuality in a relationship. Sexual overtones can distort the therapeutic relationship. Now, finding someone attractive doesn't necessarily mean that you want to have a sexual relationship with them. Where it can become problematic is if you're having sexual fantasies about the person. These become ethical and legal issues. Behaving seductively with your clients. These kinds of behaviors can influence clients to focus on romantic or sexual feelings, and you may focus on that also. You may want to talk about those kinds of situations with your client. Eventually, it can lead to engaging in physical contact that is primarily intended to arouse or satisfy your own sexual desires. Let's see what the Code of Ethics says in A5A. Sexual and or romantic counselor-client or relationships with current clients, their romantic partners, or their family members are prohibited. Are prohibited. It's just absolutely clear. This prohibition applies to both in-person and electronic interactions with relationships. This Code of Ethics is saying you just can't do it at any level. 5AB, Counselors are prohibited from engaging in counseling relationships with persons with whom they have had a previous sexual and/or romantic relationship. A5C. Sexual and/or romantic counselor-client interactions or relationships with former clients, their romantic partners, or their family members are prohibited for a period of 5 years following the last professional contact. So, you cannot have any kind of a romantic relationship with a client until 5 years later. This prohibition applies to both in-person and electronic. Sexual contact with current clients is explicitly prohibited in the Code of Ethics. Sexual misconduct with current clients is considered to be one of the most serious of all ethical violations for a counselor and is one of the most common allegations in malpractice suits. It is the most disruptive and potentially damaging boundary violation. Sexual misconduct played a role in 53% of the ethics complaints filed by the APA in 2002. In order to minimize these risks, counselors should learn to recognize sexual attractions and how to deal with these feelings constructively. Remember, we talked about talking with your peers, colleagues, get counseling yourself or your supervisor. Again, this is not something you should be talking about with your client. Seek professional support in times of personal crisis such as this. Make a practice of examining and monitoring feelings and behaviors towards clients. Be careful about countertransference. Know the difference between having a sexual attraction and acting out on that sexual attraction. Learn about the adverse consequences for clients and counselors who engage in sexual activity. Establish and maintain clear boundaries with clients by dealing with a client's sexual advances firmly and consistently. Don't let them act out on it either. Terminate the therapeutic relationship when sexual feelings obscure objectivity. Studies continue to demonstrate that clients who are victims of sexual misconduct suffer dire consequences.